Premature ejaculation is an extremely common issue that affects on average 1 in 3 men. And since it is something that you might be dealing with or somebody that you know is dealing with, here's all you need to know about it. My name is Helena Nista and I make videos that help you have the best sex of your life. And today I'm answering all the questions you might have about premature ejaculation. So PE, or premature ejaculation, used to be defined as lasting no longer than between 1 and 3 minutes. But that definition is no longer used or seen as appropriate in the situation, because we are all very different. So what we today call premature ejaculation is ejaculating sooner than yourself or your partner would like. So what that means practically is that if you do ejaculate within a minute, but you don't have a problem with that, you're happy with that, there is no frustration that yourself or your partner experience around your ejaculation, you don't have a problem. On the other hand, if you can last half an hour, but that causes you frustration because you would like to go for an hour, then yeah, that can be classified as a case of premature ejaculation. Also, if it's something that happens to you relatively rarely, that's not called premature ejaculation. Like, coming sooner than you want to can happen to anybody. And as long as it only happens from time to time, that's perfectly okay. That is considered normal. However, if you're noticing that PE is something that happens to you often, or that you were able to ejaculate or last as long as you wanted, and then premature ejaculation would happen more and more often, then that is something definitely to address. There are two main types of premature ejaculation. One is lifelong and another one is acquired. We talk about lifelong premature ejaculation when you pretty much always struggle to last as long as you would like to, starting from that very first time that you had sex. Whereas acquired premature ejaculation is more so a case where you used to last as long as you wanted, and then at some point in your life that became no longer possible and you started to struggle with ejaculating too soon. And I'm going to talk in a moment about different ways to deal with premature ejaculation. However, it's first important to look at the causes, because the kind of cause that you're dealing with in your situation, in your case, will actually determine what kind of solution is appropriate for you. So first of all, the cause can be actually genetic. It might just simply have to do with your nervous system and how your body is communicating with your brain through that nervous system. The next thing to look at is your health, because certain health conditions can affect your ability to last. For example, the hormone levels in your body. If there is a problem and an issue with that, that can actually make it more difficult for you to last as long as you want. It might be the case of irregular levels of chemicals in your brain as well. For example, serotonin is something that will affect your lasting power. The more serotonin there is in your brain, the longer you'll be able to last, whereas lower levels of serotonin can actually lead to premature ejaculation. Additionally, any kind of infections or swelling in your urethra or in your prostate can also affect your lasting power. There are different mental health issues that can also contribute to PE. Things like stress, depression, poor body image, and even feelings of guilt or unrealistic expectations about your own performance in bed. These kind of issues put stress on the body and cause tension in your system, which can lead to developing premature ejaculation. Do you experience performance anxiety? This can become this kind of self-fulfilling prophecy where maybe your body was going to work fine, but you're stressing about your performance, and hence that can lead to experiencing premature ejaculation again. Even struggling with ED, erectile difficulties, can lead to premature ejaculation. First of all, stressing about your erection and keeping your erection, that can lead to this kind of sense of stress and tension in your body that can result in premature ejaculation. But then also trying to actually rush to the ejaculation, to the point of ejaculation, because you're so stressed about losing your erection, like that can also start to develop PE in your system, the history of rushed sexual experiences, particularly if maybe you were a teenager in a household where masturbation wasn't encouraged or even allowed, and you had to do it quickly, maybe in the bathroom, in the shower, or in your bedroom, but you had to do it in a way that nobody would find you or nobody would find out about what you're doing. That kind of history of rushing to ejaculation can actually condition your body towards PE. Sexual repression in your life, particularly in your earlier life, where you had to suppress or hide your sexual feelings, your desires, your arousal, etc., that can also contribute to premature ejaculation. And even problems in your current relationship, whatever issues you're facing or problems or conflict that is happening in your current relationship, that can be contributing to premature ejaculation as well, particularly if lasting long enough is not an issue that you are struggling with in your previous relationships. Okay, so you have now hopefully identified what might be the cause, or maybe multiple causes of your case of premature ejaculation, which means that we can move on to solutions. And the first thing to think about is therapy, particularly if the source of your premature ejaculation lies in any kind of mental health issues or stress or guilt or inhibitions or poor body image, etc. Therapy can really help you feel a lot more confident in your body and relaxed in your body, which will support lasting longer. Similarly, if the relationship that you're in might be contributing to your PE, it might be a good idea to discuss that with your partner, but also maybe go to couples counseling and couples therapy. Therapy can be extremely helpful for a wide range of problems and situations, particularly if you find a therapist that you can really trust, that you feel safe with, and that can bring you results. It can be also a good idea to kind of notice and observe what particular kind of things can contribute to your PE. So if you struggle with premature ejaculation only in certain situations but not in others, like what is causing those struggles? What is contributing to your problems with your lasting power? Is it maybe the use of alcohol or drugs or certain foods that you eat or certain situations in your relationship, in your social life, in your business life, etc. So noticing and observing what contributes to your problem can definitely help you create situations where you're not exposing yourself or being exposed to these kind of factors. Some men find that wearing a condom helps them last longer. And I know that this is not a solution that everybody's going to be happy about. Not every man wants to or enjoys wearing a condom, but a condom can actually provide this kind of numbing effect, can reduce the sensitivity of your mighty wand so that your arousal grows in a more kind of a slow and steady manner, allowing you to last longer. There are also on the market different numbing sprays and creams that can help you last longer. However, it is quite important to read the instructions properly and to use the product correctly, because if you, for example, keep the product on yourself for too long, that can actually contribute to you losing an erection. Or if you don't wash it off before penetration, you might transfer the product to your partner's vagina, causing hair to become numb. There is the squeeze method, where either yourself or your partner will need to squeeze the head of the penis when you are in a high state of arousal, and then you both will need to wait for that arousal to reduce while holding that squeeze, and only then you can resume lovemaking and penetration. This method is also problematic in that it is quite disruptive to the flow of your sexual experience together. There's also the start-stop method, where you stop the stimulation of the penis altogether when you reach that high state of erotic excitement and erotic charge. So when you feel like you might be anywhere close to ejaculation, you need to stop everything, you need to take a break, and you need to kind of wait until you lose that erection and you move away from that edge of ejaculating. This is also not ideal because you might be in this lovely flow of pleasure and stimulating each other and, you know, having a wonderful time together that needs to be interrupted so that your erection can reduce. But the good news here is that while that's happening, while you're waiting for your beautiful one to become less erect, you can be attending to your partner. You can be touching her and stroking her and giving her oral sex, etc. There are also pelvic floor exercises, so basically Kegels, where you rhythmically squeeze and release the pelvic floor muscles daily in order to make them stronger. Men who exercise their pelvic floor muscles report that it really helps them last longer and expand their lasting power. And you can learn a lot more about how to do Kegels properly here. Some men choose to masturbate before having sex with their partner, and this is because typically when you go for the second time, you can last longer than you did the first time. Now that doesn't always work. It's not a guarantee, but you know your body, so you should have a good sense of how that would work out for you. First of all, will it actually work? Do you typically last longer when you go the second time? But also, will you actually be able to have an erection for the second time? Like, that can be an issue for a lot of men with this method, that their refractory period can be still going, and hence they might struggle to get hard again when they want to have sex with their partner. We also know that men who take antidepressants can usually last longer because of the effect that the antidepressants have on their sexual function. But obviously, don't ask your doctor for antidepressants if you don't need them, but you just want to last longer. I wouldn't recommend that. If you're suffering from any kind of hormone imbalance, then maybe hormone therapy is something that you can discuss with your doctor as an option here. Which brings us to edging. I personally love edging, which is a technique of bringing yourself close to orgasm and then relaxing your body, breathing deeply, and consciously spreading your arousal and your sexual energy, orgasmic energy through your body before starting to either masturbate or make love with your partner again. When done repeatedly and on a regular basis, at least once a week, this can actually train your body to last a lot longer naturally. I personally really love edging. It's not just a great recipe for lasting longer in bed, it's also an amazing way to expand your pleasure and your sensations in your body so that you can experience your orgasms as much more powerful and satisfying than they would have been otherwise. And I've made an entire video about edging, so make sure to check it out here if you'd like to learn more about this technique. It's also a really good idea to have an honest and open conversation with your partner about the situation. Couples where the male partner struggles with premature ejaculation, they can quite often feel quite disconnected in bed, particularly if they don't communicate well about this issue. There might be quite a lot of frustration, disappointment, or even anger that they're experiencing around him not lasting long enough, either from his side or her side or from both of them. And not discussing it, not talking about it can really just make the problem bigger and more prominent. And the truth is that your partner can actually help you with this issue. They can help you last longer. You guys can both discuss what's really happening, like what's at the core of your premature ejaculation, what's at the source here. And so what exact action is helpful or required in order to support you in lasting longer. And communicating about it can obviously also make you feel more connected and bring you back together, sort of emotionally and intimately speaking. And if you'd like to learn how tantric lovers master the art of lasting in bed as long as they want, then make sure to check out my powerful and hugely popular online course, Tantric Mastery for Men. This program will teach you how to train your body to last a lot longer and how to do it easily and naturally. No equipment, no pills, or no tools required. So if you'd like to learn more, you'll find the link in the description bar below.